Hello everybody, I hope you're doing well, and let's go on to our next topic. It's about premature eruption. Define premature eruption, it basically means any teeth that erupt before its prescribed time, before its normal time of eruption. Okay, this is called as premature eruption. Okay, so it can affect either the deciduous teeth or the permanent teeth. Okay, but most commonly premature eruption has been seen in deciduous teeth. Now in deciduous types of premature eruption, so first is the natal teeth and the other is neonatal teeth. So what's the difference between these two terminology? The first, natal teeth, it means premature eruption of teeth before birth. Okay, so when the child come into this world, okay, after the delivery, you will see in the oral cavity that the baby has teeth within the oral cavity. Okay, the most common teeth that involve is the mandibular central incisor. Okay, and neonatal teeth, it basically means premature eruption of teeth within 1 month after birth, after delivery. So when the child after birth, okay, you will see in the oral cavity there is no teeth at that spot, at that time. Okay, but after that, okay, after few days, within 1 month of period of time, okay, there will be an early eruption of that teeth, which is called as neonatal teeth. Okay, involved, I discussed already earlier, is the deciduous mandibular central incisor. Although it can affect any of the teeth, but most common cases that we have seen in patient is deciduous mandibular central incisors. The cause, it may be unknown, okay, it's mostly unknown, or it may be because of genetics. And there's one disease called hyperthyroidism, okay. It's basically increase in activity of the thyroid gland, so there is increase in production of T3 and T4 hormone. So basically what's going on in hyperthyroidism is that the disease basically accelerate the jaw growth, okay, and also it leads to early loss of the deciduous teeth, the milk teeth, and lead to the early eruption of the permanent dentition. Okay, so this is just one disease that is associated with early eruption of the deciduous permanent teeth. Okay, permanent teeth. What are the treatment? The treatment is basically, you know, that this premature eruption of the teeth, they are basically not a supernumerary teeth, they're basically the normal dentition. Okay, so our best, what should we do is that we should opt for no treatment plan. Okay, we should leave the teeth, we should maintain the teeth, uh, tell the patient or the parents to maintain the oral hygiene, okay, and help the patient maintain the dentition. Okay, but if the teeth is very mobile, or if the teeth is affecting the child's diet, okay, like during milking, when the child is drinking milk, okay, that time it can little bit cause problem in feeding. So for that case, okay, we can opt for extraction, but it depends on the condition. Okay, so it's just depending on the scenario. And if we see that all of the dentition, most of the dentition, okay, they are undergoing an early eruption of, okay, so you can uh, do a clinical examination for hyperthyroidism and refer the patient to physician for further consultation and examination. Okay, just to rule out the problem if there is any hyperthyroidism cases. Okay, so that's it for today. Thank you, and I hope if you have any question, write the question in the comments. I will answer any of your problem. Okay, and I hope you have a nice day, and we shall meet in the next video. Thank you. Goodbye.